Hello everyone, my name is Fillipe and I made this channel to give some lessons about cataract and retinal surgery and put some videos too. This video is about my last video who was talking about a surgery that I'm showing some tips to doing phaco emulsification without sedation. Here in Brazil, in public hospitals, it's common to operate without anesthesiologists on the operation room. So we did, in some cases, surgeries without sedation. So you need to be prepared for these cases. In this video, I'm gonna give more hints and tips to doing this surgery with more safety and to have a better experience for you and for your patients. Some resident programs here in Brazil, the residents don't know the patient before the surgery. Just on the day of the surgery, they know the eye, what they're gonna operate, which eye they're gonna operate, and who is the patient, and what cataract they're gonna operate on that day. So this is not so good because you don't develop a relationship with the patient. So the results on the cataract surgery don't depend only uh, with the surgery. The surgery, it's not the main point. The good result goes beyond a good surgery. So to achieve the better result, you need to have a good relationship with your patient. So in my residence program, the patients have a visit before the surgery, even months before the surgery, so the surgeon gets to know about the cataract, the issues, the doubts, and to do the anamnesis, to do the physical exam, and even to know the person who's going to take care of the patient before the surgery, during, and after the surgery too. So that point of the video, I'm gonna give some tips to talk with the patient that I think it's important to develop a good relationship. The main point, the first point is to know what the job of the patient. So what the patients do, he gets some weight on the job, or the patient just gets sit in front of a computer, for example. So this is important to give orientations after the surgery. And who's gonna take care of him before the surgery, this person have the doubts and the answers for these doubts before the surgery, who's going to take care of him after the surgery, who's going to take care about the eye drops, for example, and who's going to take him to the hospital and take him back to the home. This is so important to the expectation, not only the patient's expectation, but the family's expectation too about the surgery. And this point, it's too correlated to the physical exam. For example, patients who have macular degeneration, for example, this patient is not gonna reach the 100% of result. So you can't give 100% for him, even if you use the best IOL possible in the world. This patient have another disease, and he needs to know that, and knowing that he can have the exact expectation that you can give to him or her. Another thing is the special cares after the surgery, like don't sleep on the eye, for example, to take the band-aids after the surgery, to put the eye drops, to come back to the visits. This is so important. The patient needs to know what are the special cares, not the patient, but the person who's going to take care of him too. Another thing, this is so important, all the surgeons, the good surgeons, the bad surgeons, all of them is going to have some complication in some point of the life. Even the best surgeons have complications. So the important thing is the patient needs to know the cataract surgery have some complications. This is something obvious for us, but for some patients, they think the cataract surgery is so simple, and they don't think that complications may have during the surgery, for example. And another thing is, I think is so important too. The good doctor stays with the patient before the surgery, during, and principal after the surgery. So even if you have some complication, you need to stay with your patient. Even if you cannot treat the complication, you need to stay side by side with him or her to answer the questions, to give some care. This is so important. The patients needs to feel there's someone is taking care of them. Even if you don't gives him a good result, if the patient feels that you're side by side, they're going to understand that you give your best to get the better result possible for him. In this point, I'm going to talking about some tips during the surgery. I show them on the video. So the first tip is you can strap the patient's forehead on the surgical table to avoid grosser movements. During this, some patients feel more comfortable because they feel less responsible for the result. So just strap the forceps patient on the surgical table. This gentle. Don't put so much force on this. Just to orientate the head's position. Okay. The second tip is to use an atraumatic chopper on the accessory incision to hold the eye during the capsulorhexis, for example. And after you put two instruments inside the eye, you have more control, so you didn't need to be very concerned about holding the eye. So in the end of the surgery, the two tips that I'm gonna give is the blade date technique that was developed on USP. The doctors who developed this technique are listed here. They use a technique to seal better the main incision after the surgery. Principally, the incisions that are leaking in the end of the surgery, you can use before you suturing the main incision. You can scarify the vessels in the limbus and leave the blood going to the main incision, and just leave the blood for 1 or 2 minutes. To this blood seals the main incision like a fibrin glue on the main incision. I'm gonna leave on the describe of this video the link to see the lesson about blood date that these surgeons made. Another tip that I'm gonna give is to leave in a 80% bubble air on the anterior chamber. It's because when the patient gets on orthostasis, the bubble air goes up and seals inside out the main incision, and the air has more superficial tension than the DSS, so this is better the main incision, principal for the patients who don't have so much compliance after the surgery. So if you have some doubt that the patient's gonna follow the orientations after the surgery, don't hesitate, just suture the main incision in the postoperatory. This is you remove the suture. So that's it, guys. Thank you so much for watching the videos, to subscribe the channel and give the like. And I'm gonna put some new videos every Saturday, giving some tips, showing some surgeries. Thank you so much one more time. And if you're not subscribed on the video, just subscribe and click on the like.